Hi, everybody. Good afternoon on this dreary day in New England, but we can all listen to the adage of what's attributed to Mark Twain, but probably is not Mark Twain, which is if you don't like the weather in New England, wait a few minutes. And hopefully it will be better, like it was yesterday. So we're delighted to have you all here, and it is a wonderful topic that we're going to be talking today about managing pain. And I'm going to we're going to have wonderful speakers. Our usual medical director, Matt Russell, will be here. Susan Edgman-Levitan will be following me, and then we'll have our wonderful speaker, Darshan Mehta. So I'm going to pass it on to Susan, and here's to put a little sun in your dreary day.
I wish I could put a little sun in our dreary day, but I think we have sun with Dr. Mehta with us here today, and Dr. Russell and Dr. Levine. So welcome, everyone. I'm Susan Edgman-Levitan, the Executive Director of the Stoeckel Center for Primary Care Innovation at Mass General, and I'm going to go over the housekeeping rules. And given how many of you I feel like I know now, you all could probably do this. But so a few just things to remind everyone about. Everyone is muted to eliminate any background noise because we don't want anything to get in the way of us being able to hear our speakers. If you want to just view the speaker, you can go up to the right-hand corner of your screen where it says View and click on that. And you can either click that to just view whoever is speaking, or you can click on Gallery View to see all of the participants. If your picture gets jumpy or out of sync, or you have trouble hearing or you freeze, click on Stop Video in the lower left corner, and that sometimes helps speed up your connection. For questions, and I know we've got a lot of questions today, please use the chat feature in the bottom ribbon. It's right in the middle, and you just click on that and you can enter your questions. But I know given the topic today, we already have received some very specific questions from people about their personal medical conditions. And unfortunately, we can't really answer those today during the town hall, but we really want you to encourage you to reach out to your doctor. And also, I just really want to remind people that anything you put in the chat can be read by everyone. So we really want to discourage you from putting anything personal about your medical issues in the chat. We'll try to answer as many questions as possible. And with this, I'm going to get us going. So we're first going to hear from Dr. Matt Russell, who is the medical director and the director of ambulatory geriatrics at Mass General. And he's going to be, as he calls it, do a little bit on the COVID corner. And then we're going to hear from Dr. Darshan Mehta, who is the medical director of the Benson Henry Institute, and also plays a role in education at the Osher Center for Integrative Medicine that's part of Harvard. And he's going to be talking about various mind-body tools to help us deal with pain, and will also lead us through a brief meditation. So with that, I'm going to turn this over to Dr. Russell.
Thank you so much, Susan. Good afternoon, everyone. It's great to see all of your faces. And I am also very excited to hear Dr. Mehta's presentation. I think for many of us who have chronic pain, we know it's not all about milligrams of this and milligrams of that, but it's really a multi-pronged, multifactorial approach that incorporates the mind and the body. So I'm really excited for this content. I am going to just talk briefly about some COVID-related things. Can you all see my screen? What do you see right now?
COVID corner.
Oh, fabulous. Okay, good. I have two monitors. I wanted to make sure. So we've been getting some calls about whether or not we are giving out a fourth vaccine. And I did just want to let you know that we don't have any guidance about that for the general populace that we care for in our geriatric section. Excuse me. That here are the most recent updated recommendations on what we call the vaccine schedule from the CDC that for most of us, we are to have the 2 doses of the primary series. This is excluding the Johnson & Johnson, and we can get a booster at around the 5-month mark. There is also, for people who are moderately or severely immunocompromised, currently a recommendation to get a booster dose for either Moderna or Pfizer at least 3 months after the 3rd dose, which begs the question, who is moderately or severely immunocompromised? So this is the answer. People who are receiving active cancer treatment for tumors or cancers of the blood, if you've received an organ transplant and are taking medicines to suppress the immune system, if you've received a stem cell transplant within the last 2 years, or if you have primary immunodeficiency or advanced or untreated HIV infection, or if you have active treatment with high-dose steroids or other drugs that may suppress your immune response. So I hope that answers your questions effectively about whether or not you fit into the category of needing that 4th shot. Obviously, the science is still evolving, as we always say. So in 1 month's time, the recommendation may be updated, but this is what we're operating on for now. So with that, do I hand it back to you, Susan?
We can go right to Dr. Mehta.
Okay, excellent. So with that, Dr. Mehta, take it away.
All right. Well, thank you so much, Dr. Russell, and thank you, everyone, for inviting me here today. Is my volume okay? Am I?
Yes.
Perfect. Okay, great. All right. Well, let me share my screen. Okay. Okay. So, I know I'm going to be talking a little bit about chronic pain, but I also wanted to contextualize it within mind-body medicine a bit, and really think about how do we think about pain overall, and what are some of, I'll be focusing a bit more on some of the non-pharmacologic approaches, but just to note that just to touch base why some of these non-pharmacologic approaches make sense in the context of what we know from pharmacologic approaches to pain management. So, all right. So again, there was a wonderful review article in the New England Journal of Medicine and just again, I think one of the things that these pictures show, and it's more of a picture, I just want you to sort of appreciate the picture, that pain is actually very complex. We know that pain operates, there's a central nature to pain at the central nervous system, so at the brain. The way the nerves exit the brain matters. And then whatever the nerve is affecting, the point where the nerve is meeting the target, whether it's the muscle or the blood vessels, they're different things, and it affects at that level too. So when we think about pain management overall, we are thinking about a multimodal approach. So we have to think about the level at the target, at the, say if you're having back pain, and your muscles, they could be at the level of the muscle itself. It could be where the nerve meets the muscle. It could be where the nerve is exiting the spinal cord and meets it.
Pandemic safe drug and alcohol addiction treatment program in Massachusetts, Rhode Island, and New Hampshire. Now you can recover at home. AwareRecoveryCare.com. Trusted, local news.
Can everyone please mute yourself?
There you go. Okay. Okay. All right. So, and then we have, at the level, at the central level. So our actual experience of pain, it turns out we know that how we experience pain varies from one individual to the next. And there are multiple factors for this. Obviously, there's factors around our genetics. There's factors around the way we were raised and developmental and how we've experienced pain. That we know that histories of trauma play a big a role in pain management. And then finally, obviously the actual nature of the injury itself, the structural piece, what was it actually affected itself. So there, pain isn't, it turns out, just one thing where one, sometimes we feel like, oh, one part is broken and that's what's resulting in pain. It actually is much more complex than that. And I think, you speak with any pain management expert, they will all readily admit, while some pain management experts may have a specific approach which they're very good at, whether say it's injections or other procedural, all of them will undoubtedly say that it is multimodal. You have to have a multimodal approach. And we have to understand even nature, like how we actually experience, if we are, for example, feeling depressed, our experience of pain is much more different than if we are, feeling not depressed. So that's again. So there are different types of pain that many of you will be familiar with. So there's how we classify, like is it just a primary overall pain, neuropathic pain, we're really referring to sort of at the level of the nerve, post-surgical pain, post-traumatic pain, cancer-related pain, musculoskeletal pain, headaches, example. There's the nature of how long is the pain going on? Is it just short-term, acute, chronic, ongoing? Is it come and go, intermittent pain? I'll just speak for myself. I'm someone who deals with chronic back pain, but it is intermittent. So if I'm sitting in the chair for a long period of time, all of a sudden I notice that my muscles tense up and I have to actually go to a standing position, or I need to start walking. Then there's assessment. How do we assess pain? The intensity, what are the other conditions? What is our psychological functioning, physical functioning, social aspects? I have a relative recently, COVID, was afflicted by COVID a couple of years ago, but what that resulted was because they became so out of breath, they stopped walking, and now they're dealing with chronic knee pain as a result of just stopping walking because of their underlying osteoarthritis. So again, you can see a lot of this. All of a sudden, that was not the expected sort of sequelae of COVID, but that's ended up being the case. And then finally, what's important to understand, what is the way in which we feel that we can manage our pain? So if you feel that you can't manage your pain, it's very hard to control pain. But if you have a sense of efficacy, you're feeling, yes, I feel like I have something to do here. I can do something for myself. That actually helps manage pain better. So it's intuitive in some ways, but it actually turns out it's a skillful practice that people have to build. And again, you can see then because of the different ways in which pain there are so many different approaches, and these are just a sampling of some of the drugs or medications that people use, including things like ibuprofen, Tylenol, or acetaminophen, aspirin, other more, those are sort of the over-the-counter ones that we see now, patches like lidocaine patches, capsaicin cream, over-the-counter that people may be using, menthol as another thing that people will use for over-the-counter pain management. There's prescription medications like duloxetine, gabapentin, pregabalin, amitriptyline. There's more newer approaches that are still very not well understood, but for example, cannabis and some of its byproducts in the ratios of the two main ingredients in cannabis, including compounds like THC, is important to, and CBD. People have heard like CBD oil and such. Those are the components, and we actually don't know, really, to be quite honest, which ratios work well. Some people work, for some people it works well, some it doesn't work well. Some people, it may affect their psychoactive compounds for some people, and so you have to pay attention. So I think, again, this is a whole new area, and I know that the town hall is planning a later sort of discussion on this in more detail, but just wanted to say that it is being used a lot for pain management. So again, going back to the thing, you can see that one of the things that we've known in our work at the Benson Henry Institute is that stress plays a big role in how we experience pain. And reason is, again, it goes to some of the same levels. And again, I show this picture, motives show that when we think about stress and our experience of pain, stress and actually cardiovascular disease is also the same pathways are affected. And it's interesting to see there's an inflammatory response that we use our sympathetic and parasympathetic nervous systems. It affects the different axes that are from the brain down to the organs. And I think that's just, again, really important to note. And reason why this is becoming more and more important is that when we think about non-communicable diseases and conditions, which include chronic pain conditions, they're really the most important global health challenge. No longer is it communicable. And even when we think about communicable disease like COVID is a communicable disease, it actually increases the burden of non-communicable diseases, which chronic pain is so often associated with. So in things that include, like, for example, obesity, diabetes, those are the two most prevalent conditions that are associated with chronic pain. And that's one of the things to think about. Well, those are actually lifestyle-based conditions. And again, I just want to kind of show you that there's a really understanding of, there's a physiology here of the stress response. So then the question is, well, if we have a stress response, what's the opposite? What is the opposite of the stress response? And that's what Dr. Benson, who just passed away just a couple of weeks ago, coined the term the relaxation response. And his work was really canonized by this particular book that some of you probably have in your bookshelf back in the 70s. He wrote this New York Times bestseller, The Relaxation Response. And he actually began to see, he was a cardiologist. I have to not start using past tense language. Before I was saying he is a cardiologist, but he was a cardiologist that really initially looked at hypertension and found that when individuals learned to practice a mind-body approach like meditation, their blood pressure could drop by the equivalent of a medication. And he became very intrigued by this, and he studied this. And what he saw in many mind-body practices across cultures and traditions was that there are two main sort of postulates. One was a repetition of a word, a sound, a prayer, thought, phrase, or muscular activity, and a passive return to the repetition when other thoughts intrude. So he began to sort of observe that the benefits were seen as little as 15 to 20 minutes daily by breaking the train of everyday thought. And pain is one of those conditions where you begin to move into this sort of repetition of a thought pattern. And it becomes, for people who suffer from chronic pain, oftentimes the only thing they can think about every day. It's the one thing they begin to focus, and it actually reinforces those circuits in the brain. And so one of the parts of a comprehensive management is how do you break the train of everyday thought? And he found that this is really elicited by many mind-body practices I mentioned, and there are other physiologic changes, including decreased heart rate, decreased blood pressure, respiratory rate, and even molecular compounds like increased nitric oxide. The first three things we know that in many chronic pain conditions are often elevated. Heart rate is elevated, blood pressure is elevated, respiratory rate is elevated when you are in sort of, especially in acute pain crises. I'm currently working on the inpatient medical service right now at MGH, and when we see patients who report having pain, we can actually see the monitors, and there oftentimes the blood pressures and heart rates are slightly elevated, and some more than others, depending on the nature of the pain and the underlying conditions that they might be dealing with. And again, when we think about, well, how do you then, what can we do about this? And it turns out that the thing that makes us human is this part of the brain called the prefrontal cortex. It's really, that's where all of our function, like our ability to make decisions and control sort of the automatic behaviors and reactions that happen in the human. And that part is really affected, turns out, by mind-body practices. So when we lose prefrontal regulation, when we're seeing the stress response, we lose our emotional, we move into these reflex patterns. But if we move into a non-stress approach, when we actually have top-down control, where we call, and that's really affects our ability to perceive, experience, and control pain because of the nature of how pain is so closely tied up with our emotion. Well, what did they find? It's interesting when they looked at, this is now a relatively older study, but it's still so provocative and in a very positive way. They found when they looked at advanced meditators who had been practicing for like more than 10,000 hours of practice, their prefrontal cortex actually changed in size relative to people of the same age and backgrounds. And they were actually thicker. And so it turns out that while we think that our some of these things are fixed, they actually are not. And actually our brains it's often thought that as people get older, their brains shrink in size. That's often the conventional wisdom that is taught if you don't do anything. But if you actually practice a meditation, your brains actually don't. If anything, they may even be slightly different. Now, what that means clinically is still really not well understood, but it is certainly does challenge the way we often have thought about what does it mean to age and what happens in the process of aging as in human beings' experience. And it turns out that may challenge all of this. And the regions of the brain, as we begin to see, really affect cognition and executive function, emotion regulation, and even the ways that neurotransmitters are released. But it's not only that. It turns out that meditation, we've learned, it changes gene expression. So while our genes may be fixed, how those genes are turned on and off turns out is not. And it actually, we know that certain genes are upregulated, downregulated. And again, these studies, we actually know that other parts, what they call the fountain of youth, which is this part of the gene called the telomerase activity changes in terms of how genes stay young. And people who have advanced, who have regular meditation practices, their telomerase activity is different. And again, gene expression activity is different. So again, these studies we've done some of this work here at MGH, and many people across the country are doing some of these really cool and innovative studies. So the processes now we know, and this again is very important both in chronic pain management and as we think about just aging overall, is really processes called apoptosis or cellular death, our own experience of stress or the stress response, and inflammation. And really now we're talking about, well, then let's bring it to a broader concept of successful. And I know this is a concept that is talked about here extensively, but really what is, how do we then, when we think about even pain, it's about avoiding disease, staying engaged with life, and maintaining high cognitive and physical function. And again, part of this is how do we maintain activity? Again, it's very hard to do that when you're having chronic pain. How do you keep your body function and structure? And so there are environmental and personal factors, but it also means engagement. And one of the things we've learned from our work at the Institute is that anything really has to approach all of these dimensions. And I'm going to show you a little bit about how we've tried to do that. So again, this is even as we think about right now what's happening in COVID, this is also just as important. Just optimizing our health, physical health, mental health, cognitive health, facilitating social engagement, and manage, and how this also is in the context of managing chronic conditions. So I just want to I'm gonna sort of just kind of give you a few more points, and then we'll go into mind-body exercise. So as I mentioned, one of the things that conditions like diabetes, obesity are really implicated in chronic pain. Well, it turns out that those that are who are the ones that are most affected by COVID, and this is just something to think about, even as we're still dealing with COVID currently. Maybe even though now vaccines have helped improve the disease severity, but even now we're seeing this whole syndrome of long haulers, people who have been affected by COVID and then deal with oftentimes chronic pain afterwards if they've been afflicted by COVID. And it turns out that severe outcomes still continue to be those that have these sort of lifestyle-related conditions. And it turns out that the more risk factors you have, the more severe your consequences. And so really it's important, even at any age, to continue to work on risk mitigation, which is working on lifestyle, which includes nutrition, exercise, stress reduction as the key pillars. And I think this is one of the things that has been sort of the missed message in oftentimes, and I've been sort of on this stump to really, advocate, why aren't we talking more about other risk mitigation, which includes obviously hand hygiene, vaccinations, and mask wearing as being parts of it, but we're often missing the boat on lifestyle factors as well. And it turns out that those are now, before our rates of depression have gone up dramatically because of the social isolation that people are experiencing as a consequence of some of the public health measures we have to put in. So we have to be very active. And again, we know that when people are more depressed, the experience of pain is much greater. So here's one of the interesting things that I wanted to show you. It turns out that this is an old study now, 30 plus years old, was that when this was given in young, healthy adults. Basically, they gave them different viruses that cause the cold. And then they put them in a hotel, and they basically said, who gets the cold and for how long? And they looked at what's your level of stress before giving them this virus. And I think they were obviously compensated for their participation in the study. But they put them in a hotel and they saw who got, and then there's some common viruses like rhinovirus, respiratory syncytial virus. Some of you may have heard of these words. But you'll see that, those that had high stress versus those that had low, the percentages of people that got the cold were much higher with those that were high versus low. And you can see all the way to the right is this one that says CV, and high versus low. And you can see, wow, that's a pretty dramatic difference between those that are high versus those that are low in terms of the percent that got cold. And CV stands for coronavirus. So this is a fascinating study, showed that, again, this is a different coronavirus than the one we're dealing with, but in the same family. And something about it, it makes it very susceptible to stress, it turns out, and our experience of and how people are affected by this. Well, here's the other piece I'm just going to say. We just talked a little bit about vaccination boosts. They think, well, what boosts your vaccine response, immunologic? Turns out that this is another beautiful study that was done, that people got the flu vaccine, and one group just got some education about the vaccine, how to live healthy, and the other one were taught how to meditate through a program developed at University of Massachusetts called mindfulness-based stress reduction. And they found that at the end of 8 weeks, the vaccine titer response in those that were in the meditation group were double those than the just got regular health education. So again, another way to really maximize our response, one of the things we're kind of missing in some of our public health messaging, and I hope that people will take advantage of some of these low cost, low risk measures that we know have really significant public health impacts, especially in vulnerable populations, including those with multiple, as people get older, as well as with multiple medical conditions. So our program we've developed at the Benson Henry Institute is called SMART, or Stress Management Resiliency Training Program. We have one that really focuses on successful aging. And again, we've found that people who engage in this work are really, we really believe that really can be built on a 3-tiered process, ongoing practice of techniques that elicit the relaxation response, building awareness of stress and its negative effects, and promoting social connectedness and healthy lifestyle behaviors. This is an 8-week multimodal program, incorporates elements of modern psychotherapy with wisdom traditions through mind-body practices. And we found these are some of the tools that we teach, including relaxation response, mini relaxations, mindfulness, cognitive belief, sleep, diet, exercise, humor, and importantly, social support. Our work really happens primarily in group-based interventions because of, and at this point, we're doing everything virtually, but it has been really amazing to connect people in the shared experience of skills building. And again, as I mentioned, we run a specific program focused on an older patient population called our MindBody Program for Successful Aging. What we've seen is it reduces the frequency of medical symptoms, including pain and fatigue, and for example, GI symptoms, severity of psychiatric symptoms like anxiety and depression, and increases health promoting lifestyle, which includes health responsibility, stress management, and most importantly, I think, is spiritual growth, which is really this idea of being connected to something greater than the self. And I think, again, as people get older, this notion of being connected to something more than the self becomes an important dimension of sense of well-being. And we find that in our group work that this is one of the things that we've seen and observed on a continuous basis. So as was mentioned earlier, we want you to talk to your providers, obviously, about some of this work around, especially in mind-body practices and how they can be helpful in chronic pain management, particularly, but overall sense of well-being. We're obviously very accessible here at MGH. And please do not hesitate to reach out. So with that, let me just end my show here and unshare. But I thought it would, if we can just do a brief mind-body practice And then I'm happy to take any questions afterwards. So with that, what I'd like to invite you to do is to feel comfortable in your chair. And as you feel comfortable doing so, just allowing your eyes to gently close. Or if you like, having a soft gaze towards a spot on the floor or desk in front of you. Letting your hands rest in your lap or on your knees. And allowing your feet to feel supported by the ground beneath it. Noticing if there's any tension in your neck, your shoulders, your back, or your hips. Simply acknowledging that tension and seeing if that tension is necessary for you. And bringing your own awareness to a triangular region that is surrounded by the bridge of your nose, the edges of your nostrils, and your upper lip. And simply noticing your own breath as it passes through that region. Perhaps it may be fast, it might be slow. It may be deep or it might be shallow. Perhaps you may notice the gentle touch of your breath as it passes over your upper lip. But whatever you notice, allowing that to be as it is. Not trying to change it in any way, but simply noticing it. And if you notice your mind wandering, simply acknowledging that and gently but firmly bring your own awareness back to your own breath. Not trying to change anything, but simply noticing. And it may even be different from one moment to the next. As you feel ready to do so, you need to allow the sounds and sensations around you to re-enter into your awareness. And if you've closed your eyes, allowing your eyes to gently open. Okay. So, welcome back, everyone. If you'd like, what I'd like to do is invite all of you, if you want to just type one or two things or just share in the chat anything about your experience. What did you notice? And if you want to just type about your experience of in the practice, if you want to just put something in the chat. Go ahead. Or you can raise your hand and share something. Almost fell asleep. Very good. That's good. There may be a few of you
People
that are
can't
asleep.
raise, they can't raise their hands. So if
Oh,
they
they
have,
can. Okay, so
no,
then
they
can
have
type it in
to
chat.
put something in the chat.
Okay, so if you're into a sense of calmness, simple grounding, good. Okay, there's a quick. Does one tend to breathe slower and slower? It's interesting. That's a great question. Oftentimes we do observe that in many of the practices that the breathing rate does decrease. So the fact that you noted that about yourself is fascinating. You see, awareness of the body in the midst of a busy day, focus. You're noticing a sense of focus, good. Any other comments? Good. Okay. Well, again, gratitude for a chance to slow down. Oh, beautiful. So again, you can see this was about a 6-minute practice that we did. Some of you may have felt like an instant, and for others it was an eternity, and probably something in between for everybody. But it is what's interesting is that you know, as you notice, you didn't have to buy anything, get anything. You know, there are no like lights or candles or music or anything, and that's fine. Some people like that, and that's okay. But what we've come to appreciate at the core of this type of work, you actually have all the tools that you need. And I think that's one of the things that we want to just sort of impress upon everyone is that there's nothing to really get. You actually have it all. So, okay, so I will pause there and invite any questions from.
I'm just going to make a very quick comment because I've had rheumatoid arthritis for 52 years, and meditation and this kind of work has been a lifesaver. And one of the reasons is that it totally helps me reduce pain, and it's with you anywhere you go. You don't need anything extra. You don't have to worry if you've forgotten something that might be helpful. And no one even has to know you're doing it, and it makes a difference. So I just wanted to share that with people, because for me, it's been much more powerful than many of the medications that didn't really make my pain better and just made me feel worse.
Thank you for sharing that.
Yeah.
I do want to just make very clear to everyone that, again, in our clinical work, as was mentioned at the outset, I'm a physician. I'm an internal medicine physician, and I just want to I believe very much in the importance and power of medications and in the management of any chronic medical condition that obviously the evidence and the science supports. But what we also know is that it doesn't take away from the self-care strategies that are also just as important. And Dr. Benson used to call it the three-legged stool. You have sort of the arm of procedures or surgeries, you have the arm of medications or pharmacologic stuff, and then there's the self-care arm. And they're all equally important. And we often tip the balance towards surgery or procedures and medications. We often forget the self-care piece. So really to keep it all in balance is really important. And again, oftentimes many providers are uncomfortable talking about this. So, I mean, at our institution, at least we have the institute here. So you're more than easy. If your provider is not comfortable having that discussion with you, that's okay. You can just, it's very easy for them to send the dialogue or pass the dialogue to our team at the institute.
I have a question for you. And you can let me know if this is not something that you can answer right now, but there are many non-pharmacological ways of managing pain, acupuncture, massage, etc.
Yes.
Can you maybe say just a little bit about the different modalities that might be best, depending on what the nature of the pain is?
Yeah, it's a lot of research. It's really an exciting time. As was mentioned earlier, this field of integrative health and integrative medicine has exploded. It turns out actually most exploded in patients over the age of 65. The utilization has dramatically increased, in part because when you are on, people do not like the side effects of some of the pharmacologic agents and are looking for other strategies. So they all work differently, and I think we're trying to understand in whom things work for and why. To give just an example, acupuncture is still very poorly understood in terms of why it works and how it works, but it does work. It turns out it works well certainly in cancer-related pain. It's been used, and nausea, used extensively, and we certainly have it offered here at MGH as a part of our services, but also in other chronic pain management, like say the most common one being like say low back pain and sort of the things that cause chronic low back pain. It has been shown to be an effective option. But to kind of go a little bit deeper into your question, the mechanisms by which some of these modalities work is not well understood. Again, because we know that pain works at multiple levels. So some people, if you've ever gone for a massage, some people really love massage because they love that sense of physical touch, someone putting their hands on and we actually, even as physicians, we're taught that the touch, how we do a physical exam is actually a very important part of actually the treatment of the patient itself. There's a connection that is created, and that in itself gives a sense of self-assurance. Someone is taking care of me, and even that knowing that is in and of itself gives a sense of relief. And so I think it's certainly at the level of just that is one, but then also there's obviously the level of, we call the fascial plane. It turns out that in medical school, we were taught when we learned anatomy, you kind of go through the fascia to learn the muscle and the bones and all the other things. But it turns out the fascia is actually a very important part of our body, and probably a lot of pain, our understanding of pain or how pain is experienced probably is at that level. And that's where approaches like some of these manipulative therapies like massage, as well as acupuncture, it turns out is operating at the fascial plane. That's what a lot of people are believing. It's just that we don't even understand what that plane means and how to best study it. And then lastly, I just would say that I think it's an exciting time. There's a lot of certainly tax dollars, research dollars being put into understanding non-pharmacologic approaches to pain, because as we're seeing more and more chronic use of some of these medications, most recently, as we learned, aspirin, which we thought was so good for everything, but turns out maybe not. Ibuprofen and NSAIDs, we know that chronic use of that probably overall harmful for most people. So again, when we look at societally, most of these pharmacologic options are not really great in the long term, but for some people it's individualized and maybe great in certain ways. So those things are very hard to figure out, but we know that broadly speaking, it's probably not good for everybody all the time. And that's, I think, safe to say for a lot of these pharmacologic options for pain.
Great. You all are kind of a quiet group today.
I don't know. You put everyone to sleep, or
We're all deeply centered.
I don't think so, but I do have one other question, and this is something we talked a little bit about before the presentation today. But can you say a little bit about the MindBody Institute? Has different programs and resources about meditation, and there are also other apps that one can use. Can you just say a little bit about those?
Oh yeah, this is becoming a big industry.
Yeah.
That is actually, those of you who follow the stock market and stuff, there's a lot of actually big investments being made in these meditation and apps and companies. But in part is because people have recognized that there is this tremendous need. And if we can have a lower cost option that more people can benefit from, then obviously let's do. And again, so some of these, and technology is really advancing this at an exponential rate. So, and again, I don't have any financial ties to any of these companies, but companies like Calm, Headspace, Insight Timer, 10% Happier, and many others that have really blown open this field of meditation, because it's very easy now to access. In certainly in countries like the United States, the prevalence of smartphones is at high levels across all socioeconomic groups and education levels, and so it's very easy to, and even in lower income and lower income countries, they smartphones are still everywhere, turns out, and you can actually do some very cool things on these with these apps. And so I've played around with several of them. They're quite slick, and they can be used to support a practice. With that being said, our clinic at the Benson Hedges, we are fundamentally a clinic. We really are working in a clinical setting. We're working with patients and medical conditions, and because we believe this to be a treatment as a part of overall part of care. And so I found through my own clinical experience, and I think the research certainly supports this, is that having guidance by a live person initially helps, instead of starting sort of right to the app. And the apps can actually support practice, but I don't know if it's a great place to start, especially if you've never had experience. And I would recommend that you talk to your provider, and if it seems appropriate, certainly our institute like ours, and there are other places too, but at least locally, we're one important and easy resource to access, and we would recommend that you do, because I think guidance matters. Just like any coaching for any skillful practice you want to do, it's helpful to have a little bit of coaching in the beginning before you become independent after.
And another thing I just have a quick question about is, can you say a little bit more, and Dr. Russell, you may also want to comment on this, about the relationship between social isolation that many of us have experienced during the pandemic, and how that affects our sensations of pain. And maybe some of the things, you did talk about some of the things to do to help with that, but would you like to say something about that, Dr. Mehta, and then Dr. Russell?
In terms of, again, I think one of the things we've noticed, again, in our work, we run most of our work that's been most successful, certainly through the research, has been done in group-based work. And there's something about the power of the group even if they're strangers getting together for learning a skillful practice, is really, it's palpable. I mean, I do a lot of my work here amongst actually clinicians and practicing providers. So as some of you know, there's a high rate of burnout amongst in the healthcare profession at the present moment. And one of the strategies amongst sort of a, again, comprehensive approach has been to use some of these mind-body approaches as a way to teach clinicians skillful practices. And again, it's similarly with any patient care. I think doing things in groups has been really a huge part of, I think, why it's been successful.
Dr. Russell, do you want to make any comments?
Yeah, sure, absolutely. So as a palliative care doctor, you know, I'm often having to help folks who are experiencing pain. And there are a few things we know about pain. Pain is always worse at night, and it's always worse when we're alone. We know that distraction really helps. And that's why pain is worse at night. There's nothing to distract us. So there's delightful benefit of being engaged socially in terms of pain management. It's sort of like we get out of our own, you know, one signal story by having to use our different parts of the brain to incorporate other stories. So, you know, when we start talking about distraction, like listening to music that thrills and excites you, listening, you know, going out for a walk or doing exercise that might actually help the pain, obviously, rather than exacerbating it. All of these things are so important. And certainly isolation, you know, this is just yet another nail in the coffin of when you're isolated. You know, we know it can help you. When you're isolated, you have poor health outcomes overall. You can have functional decline, you can have cognitive decline, your pain can be worse, your mood can be worse. Stay connected, stay social. That's why we're doing this. I mean, and you know, we're doing this obviously to give information about COVID, but one of the benefits of this program is that we stay connected. We're engaging the different parts of our brains just by attending lectures and going on to Zoom meetings to keep us active. I hope I didn't sound too preachy, but I do really think that it is the name of the game, is to have many things going on to be able to distract from those one pain signal pathways.
Thank you. Dr. Levine, would you like to add anything to that? You're on mute.
I was thinking about that as Matt was talking, and I think one of the things that's been so hard during COVID is the lack of connection that people have, plus the lack of exercise, plus the lack of normal routines. And it sounds like just listening to this, we can make new routines and have new kinds of exercise that are not only the ones that exercise our bodies, but that also exercise our minds. And I was thinking about how useful that would be. And I wondered if there are ways for, besides these apps, to learn more about this. Are there courses? Are there videos? Are there places to learn this without coming to a clinic that people can get information?
Yeah, I was going to ask about that as well, because I think there's some excellent books too.
Yeah, no, there's certainly, again, excellent books. And then beauty, again, I think as for us, in the silver lining in the pandemic is that most of even our clinical work has become virtual. So it's very easy to access now. So even meeting with a clinician and getting personalized guidance, I think, has been very beneficial for a lot of patients. But certainly there's, you know, the industry has exploded around this, and so there are a lot of self-help books but again, as mentioned, we run courses. All of our courses are virtual for patients at the present moment, and I think for the foreseeable future it will be virtual. I think it just gives more access, and people feel comfortable learning this in their own home, because that's where we want you to actually practice this, is in your own home. And so I think that's but there's a lot of guidance. And I think in Massachusetts, we've been lucky to have sort of these internationally renowned experts sort of lead some of these programs. Obviously, Dr. Benson at our institution, Some of you are familiar with John Kabat-Zinn and his work from University of Massachusetts Medical Center. And so that's been another, we're sort of have a treasure trove here of luminaries. And it's been really helpful for certainly in the medical context to see how we can implement these and be sort of innovative in their application across, again, multiple types of clinical and non-clinical populations.
Yeah, and the Relaxation Response, I think, is an excellent book. And John Kabat-Zinn has many books. One of my personal favorites is Wherever You Go, There You Are.
That's my favorite too.
So,
Yeah.
But I think there are lots of resources. So we would
we do run continuing medical education or continuing education conferences as well.
Great.
That are both online and in person.
Great. Well, I'm going to see if there's any one last question because we have about 2 minutes. And then we'll let everybody get ready for the big snowstorm. So not to bring everybody's blood pressure back up.
Nobody remembers that it was 70 degrees yesterday.
I do. I'm watching little bulbs come up. So any last minute question or comment?
Just a reminder that if folks do have topics they would like us to speak to on the town hall, in the town hall format, we are eyes and ears wide open for suggestions. Apparently mouth not too good, but we're really hoping to get more patient-driven requests rather than, hey, we think this would be a good idea, because we want to stay relevant. Obviously, COVID will be with us for a while, so we'll always have some element to touch on with respect to that.
I like COVID corner better than COVID main stage.
Exactly. Now it's just an opening act.
All right. Well, I really want to wish everyone a wonderful rest of your day. And we will be back in touch about what our next town hall will focus on. Take care. And thank you, Dr. Mehta, Dr. Levine, and Dr. Russell.